Lamu County is home to one of the most beautiful archipelagos in the world. Some of its pristine beaches are visited by thousands of tourists annually. However, residents here, across the mainland and on the islands, have limited access to healthcare. Most patients travel great distances to reach medical facilities. In this sparsely populated county, normal medical procedures can become a life and death matter. This is Mpeketoni Hospital. It is one of the 6 healthcare facilities in the 6,273 kilometer square county. According to various estimates, the county has a population of close to 143,000 people. Here, there are just 2 doctors for every 10,000 patients. Lack of enough healthcare professionals posing as a great challenge.
The ratio of a doctor to the patient is about 1 to 25 per shift.
It is with this in mind that Lamu County government partnered with Gertrude's Children's Hospital and Safaricom in launching Daktari Smart initiative. The program uses telemedicine technology to link and allow local healthcare professionals and patients to remotely consult with specialists in towns and cities.
You can listen at the episodes.
25-year-old Nelinjeri is a mother of 2. Like many patients here, her journey of seeking medical services has not been easy.
Aliconverse akiwa hapa Mpeketoni, nikamleta hapa hospitali. Then after converse kuamka akakuwa ameshikwa na stroke. Stroke tukakuwa referred Mombasa. Mombasa nikaenda, nilikuwa na pesa ya kumpeleka Mombasa. Kufika Mombasa tukaambiwa twende Gertrude. Kwa inahitajika 70,000, ikabidi mabeshte zangu amefungua WhatsApp group.
Margaret Nyambura is also here on a routine checkup for her 7-month-old baby. Since the onset of the pandemic, her movements have been limited as she fears for her health of her children.
Changamoto ilikuweko wakati huo, kuna kuogopa mambo ya kwamba usiambukizwe corona. Hiyo ndio changamoto yenye ambayo tulikuwa nayo.
Nyambura's child has respiratory condition that requires constant treatment in Mombasa, some 250 kilometers away.
Nilitumwa kwa daktari mwenye ambao wanawasiliana na daktari mkubwa through computer. Na akawa anawasiliana akiwa sehemu yenye ambao yuko akawa anatibu mtoto wangu.
The telemedicine program includes a kit which has electronic medical devices such as electronic stethoscope, vital signs monitor, dermoscope camera, ultrasound machine, otoscope for examining the condition of the ear canal and eardrum, and the electrocardiogram to check the heart's rhythm and the electrical activity.
The physical referrals were hectic for the patient because it meant having an ambulance to go to the other county, and it had to be an emergency.
Approximately 40 to 50% of Kenyans who are today went out for treatment in an outpatient department, mainly in our public facilities, are most likely to be back within the next 2 to 3 weeks with similar symptoms or same symptoms.
Even though the country is yet to enact laws regulating telemedicine, efforts to have them in place are still being pushed for.
Over 72% of Kenyans who love to go to the public hospitals, but because they go to the public hospitals and they don't get the services that they deserve to get in those facilities, because there are no personnel, they end up ending in the private facilities. And that's why we have higher retention rate in the private hospitals.
At least 32,000 patients are targeted in this project in areas such as Lamu, Samburu, Homa Bay and Baringo. A recent report by UNICEF Kenya stated that the child mortality rate had reduced by 2.56% from 43% deaths per 1,000 live births in 2019 to 41.9% deaths per 1,000 live births in 2020. Milia Kisenya, K24 TV.